Hi, everyone. Happy National Black HIV Awareness Day and happy Black History Month. My name is Brady Maiden, and I am the Community Science Program Manager here at the Southern AIDS Coalition. And I am honored to be joined here today with the Honorable Captain John Ogatumolade. So, Captain John is the Ending the HIV Epidemic Initiative Coordination Lead in the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Health, Office of Infectious Disease and HIV/AIDS Policy. So, again, first off, I want to thank you so much for joining me today, Captain John. And it's so amazing to see Black people in leadership positions, and it's just really encouraging for folks like me who want to continue in this field of work. So, first off, I wanted to start off with an icebreaker. So, given today being NBHAAD and the theme engage, educate, and empower, really uniting to end HIV in Black communities, I thought it would be a good idea to really lean into the word empower and what inspired us to do the work we're doing. So, the icebreaker is describe what was that moment or memory you have that really inspired you to begin your work in the public health slash HIV field.
Thank you so much, Brady. It's such a pleasure to be here. And thank you for the opportunity to have this platform of yours to commemorate the National Black HIV/AIDS Awareness Day. Just before I get into the question, I first want to appreciate the leadership of Southern AIDS Coalition for their commitment to ending the HIV epidemic. Special thanks to Ms. Dafina Ward, Madrigus Harris, for all their impactful work and the various opportunities that we've had over the years to collaborate towards ending the HIV epidemic. We're so glad that Ms. Dafina Ward is part of our Presidential Advisory Council for HIV and AIDS, and she's already making significant contributions to that advisory council. Also, I am here as the ending of the HIV epidemic coordination lead in the Office of the Assistant Secretary for Health. But I want to say that the work that we do is in collaboration with the various agencies within the US government, which includes operating divisions within the Department of Health and Human Services, CDC, HRSA, IHS, NIH, SAMHSA, and HOD programs. And all these operating divisions work together to end the HIV epidemic. And I really want to acknowledge their leadership for their visionary leadership and all the activities that they implement across the 57 jurisdictions to end the HIV epidemic. I also want to bring greetings from our leadership in OASH, Office of the Assistant Secretary for Health, Ms. Kay Hayes, who is the head of our office, Deputy Assistant Secretary for Infectious Diseases, and Mr. Tim Harrison, who is the Principal Deputy. Now, to respond to your question, how did I get into this field? I actually started as a HRSA scholar in 2006. There was a scholar program, and during that HRSA scholarship program, I had the privilege to work in HRSA, Health Resources Services Administration. And I had the privilege to rotate across various bureaus. And I spent about 3 to 4 months in the HIV/AIDS Bureau under the special projects of national significance. And I saw various opportunities to engage community and have innovative processes to reach communities disproportionately impacted with HIV. Then from then, I got kind of an aptitude and a desire to work in the field. And I started with that. And before long, I saw myself working within the HIV/AIDS Bureau Global Health AIDS Program, which was a program that was a PEPFAR program. That's the Presidential Emergency Plan for HIV, for AIDS relief. And I managed the program in about 10, 11 countries. And as a result of that, I got into global HIV work, which was extremely fascinating, being able to travel to these many countries and support them with US government resources to end the epidemic within their countries. And since then, went over to CDC, served for a number of years. I was stationed at CDC Mozambique for close to 4 years before coming back to the regional programs here in OASH, and I was stationed in Region 4 for about 4 years, helping to coordinate the ending of the HIV epidemic work before about 7 months ago when I now ushered into the national work, where I now serve as the national EHE coordination lead in OASH. So it's been an interesting HIV journey. I don't know if I chose it or it chose me, but for one reason or the other, for close to 2 decades now, I've been working actively in the field. But thank you for that question.
Of course, and honestly, I think we're glad it chose you. So if it didn't, I wouldn't be here with you today. So I appreciate it. So earlier, Southern AIDS Coalition had released a video highlighting what does NBAD mean to you. And I thought in honor of the day, you can really like share again your thoughts. And this is also leaning into what brought you into this work on what NBAD means to you.
Thank you. That's a very important question. When we talk about NBAD, National Black HIV/AIDS Awareness Day, this year's theme is very, very captivating for me. Includes engage, educate, and empower. And that is so critical that we find ways to engage and exploring ways to better involve Black communities in HIV/AIDS prevention and treatment efforts. And it's also very important when we talk about educate that we focus on improving HIV education amongst Black youth and adults, education about HIV prevention opportunities and debunking myths that contribute to stigma and discrimination. Then also, it's important that we empower, highlighting various success stories and strategies that have effectively empowered Black individuals living with HIV and AIDS. And this is really critical for me. But in order to do all this, to engage, to educate, and to empower, first of all, it's important for us to acknowledge. And when I say acknowledge, we need to acknowledge the disproportionate impact of HIV within the Black community in the US. The Black community represents just about 13 to 14% of the US population, but accounts for about 40% of the new HIV infections in the US. And as we acknowledge this, we need to also understand that factors impacting the Black community go beyond the purely biomedical intervention. These factors are not a one size fit all, but we need to engage a syndemic and holistic approach that involves various wraparound services to ensure we move closer towards health equity within the Black communities and finding ways to reach the community where they are. Then the last word that comes to me is advance. It is very important that after we've acknowledged and now that we understand the challenges, we now advance intentional, meaningful interventions and solutions to move the community towards health equity. And that involves a lot of intentional activity, looking at systemic factors, looking at structural factors, looking at provider level factors, looking at community factors, and all the factors that impact the Black community from a socio-ecological perspective, looking at individual, looking at the relationship, looking at the community, looking at the society at a large, and addressing the variables on all these levels for us to really move closer to health equity within the Black community. So this is critical for me, and this is what MBAD means to me this year.
No, that was a very strong and powerful answer. And honestly, I think really just hitting those points about the theme about engaging, empowering, and educating. One question or one word I really want to start leaning into is engaging. So, what does continuous engagement between EHE and particularly communities of color and Black communities look like? So, one of my questions to you is what steps will be taken to strengthen these partnerships with local Black community organizations and leaders, considering their vital role in advocacy and support in the movement?
I think that is a very critical question, and it's important that we cannot overemphasize community engagement with the Black community. As I mentioned earlier, the Black community uh, accounts for about 40% of the new infections, despite being 14% of US population. And it's important that our work involves engaging the community, especially the Black community that is disproportionately impacted with HIV. And many times when we talk about community engagement, we're not just talking about creating a product and delivering it to the community. This involves moving towards the community, creating community buy in, community partnerships, community co-leadership, community rollout and implementation of programs, and even community being involved in evaluation and course corrections of programs. One of the things that I've learned over the years is that there's usually a priority to capture data that tells us who the priority populations are and where the priority populations are, which is like data that prioritizes the where and the what. But many times, community engagement will help us understand the data of the why, because there's a why and there's a reason why these communities are disproportionately impacted. And until you understand the whys, you would not be able to get to the hows to mitigate these health disparities within these communities. So this is very, very important and significant for us. And all our implementing partners and all our partners across the federal agencies, CDC, HRSA, NIH, IHS, SAMHSA, all understand the vital importance of community engagement in addressing our programs and ensuring that the feedback from community engagement is incorporated into the interventions so that we can have effective and optimal responses and move closer to health equity. So engaging Black community is so important. Engaging Black CBOs is very important. Engaging Black advocacy groups is so important, and working closely with them in partnership towards ending the HIV epidemic. So this is of vital importance to us. We're already involved in this. It's something that we're committed to continually doing. And I know that as we continue to do this, we would end the HIV epidemic. One quick thing that I also wanted to note is that about 7 months ago, I had the privilege to come to this national role as serving as the ending of the HIV epidemic initiative lead. But since then, it's been important for me to ensure that I go to the jurisdictions, because I could have meetings at the leadership level. I could have meetings in the boardrooms. I can have meetings in the offices. But many times it's important for you to be where the people are and engage the communities that are disproportionately impacted, to hear critical feedback from them and ensure that we're working closely in partnership with them to address the issues within those communities. So as a result of this, I started with the 7 states that have substantial rural burden of HIV. And I had the privilege to go to Mississippi, Alabama, Kentucky, South Carolina, Missouri, Oklahoma, and Arkansas. And in all these states, I had leadership meetings with them. I participated in site visits and meeting with community-based organizations and prioritizing non-traditional methods to reach the community, especially the Black community where they are. And finally, having community engagement sessions at the jurisdictional level to understand those things that are important to the community, those X factors that can help us move the needle and ensure we're on trajectory towards ending the HIV epidemic. And we've been able to meet multiple leaders, heard from multiple communities. And since then, beyond the 7 states, I've been able to go to the 7 individual jurisdictions in Florida, gone to the 3 in Ohio, gone to the 4 in Georgia, and right now we've done 22 out of the 57 jurisdictions in the last 7 months. And next week I'm going to be in Texas, going to 4 of the 5 EHE counties in Texas. So community engagement, community participation is so important to us. And this is not just a concept to us. We're really doing this by going to the community, meeting with community, hearing from the community, and partnering with the community to ensure that we end this HIV epidemic within the Black community.
That was really just an impactful answer. And I appreciate that you're taking the opportunity to engage with community, because I think so often there can be a separation, and having a leadership, having that representation in the room and being able to hear community voices and receive that feedback from them and then enact it into other initiatives and like the overall EHE goal is, I think, impactful. And I really think is what sustains this movement. And so I wanted to really drive home a point where you were talking early on about data, looking at what data looks like when 14% of the population, which is Black people, account for 40% of new cases. And so that leads into the other word for our theme, which is educate. And so we don't move forward in this movement without giving folks the knowledge and the understanding of what HIV prevention is, the misinformation that is really currently out there, and how through different approaches, and I know you've mentioned the systemic and holistic approach, we can ensure our communities are really equipped with the information needed to make these informed decisions about their health. And so acknowledging the existing disparities in HIV data collection and reporting, how will the EHE initiative really work to improve data accuracy and representation, especially for Black populations?
I think that is a very, very important question. And HHS agencies providing service delivery programs and partners at NIH all take data collection and data accuracy very, very seriously. As you know, CDC and HRSA work very closely at the jurisdictional level to collect and analyze data and use data to inform program initiatives and priorities. But as I mentioned earlier, it's important that we also continue to capture the right data, not just the data of the where or the data of the what, but the data of the how and the data of the whys that would inform the how to mitigate these challenges. The other important aspect of data collection is also the level of disaggregation of data. For instance, when we look at national level data on PrEP uptake, we can tell that over the years, we can see improvement in PrEP uptake over the years. We haven't seen enough improvement, but by the time you look at the data as of 2020, nationally, for all those that require PrEP prescription or are eligible for a PrEP prescription, nationally it was 25%. As of 2021 data, nationally it was about 31 or 30.1%. And even in 2022, it's a little bit higher. However, when you do disaggregate the data by race, you can see the disproportionate uptake of resources. And you can see that despite the fact we're seeing a general increase holistically or a general increase in aggregate data, by the time you disaggregate that data, the community that is most significantly impacted with HIV, representing about 40% of the new infections. When we talk about PrEP uptake, we can see that the PrEP uptake within the Black community is only about 13% at the moment. So it's important not just for us to capture all the data, but effectively disaggregate the data to know which communities are lagging behind, which communities need additional attention, which communities need additional prioritization of resources to move the numbers up and to increase uptake. And this data would also help us to answer specific questions. Questions like, why is there not enough uptake within this community? Are there questions of access? Are there questions associated with medical mistrust? Are there questions associated with education? Are there questions associated with misinformation? Because for each community, it could be a little bit different. So it's important that we capture the right data. It's important that we capture the right granulation of data. Then it's also important that we capture timely data. We don't have many, many years to end the HIV epidemic. So it's important that we capture the right kind of data in a timely format so that we can see all the variations and the disaggregation of the data and now use that to inform adequate and timely course correction to move us towards the trajectory that we want to end the HIV epidemic. So you're correct. Data is critical. Our agencies are taking this very, very importantly. They're doing significant work, working on the data, ensuring that we have timely data. And now we're going much more into the community, not just to have data that is in form um, 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 of numbers, but data that can give us quality information about the why so that we can inform ways to better address this initiative in communities that are disproportionately impacted. So this data issue is something that we're taking seriously. We're looking at it very closely and we're using it to inform change to optimize our program outcomes.
And thank you for that answer. So I appreciate the overall one answer, and then just like one of the points that you made about data telling the story. So we recognize that Data tells the what and the why, and it tells the story and allows us to look and address the gaps. But one thing is, when we're translating this information, that's also where misinformation and that sort of stigma and a lot of other issues come into play. And so, in what ways do you envision educational programs really educating us about the data that's out there in regards to folks living with or impacted by HIV, particularly the Black community? What educational programs do you see specifically addressing this HIV awareness and prevention for the community?
Thank you so much. And I think the issue of education is critical to ending the epidemic. Education for the individual, education and capacity building for community-based organizations, education and capacity building for providers, education and capacity building for communities that are disproportionately impacted with HIV to know about access, to know about the resources within their community. I think all this is of extreme importance. We have to continue to push out information regarding awareness and available resources to prevent and care for people with HIV. But when we talk about the issue of education, I want to also bring up a very important point. We also have to understand and recognize the role of stigma, misinformation, medical mistrust to ensure the right information is received from trusted messengers. One of the things that is very critical is for us to know that within the Black community, there are various demographics, and we will reach different demographics through different platforms. It's also important for us to note that although we may have the correct message and the right message, but we may not be the right messenger to
Yeah.
deliver it to the community. This is of extreme importance because we have a history within the country of medical mistrust, and as such, you may have the best message, the accurate message, but you may just not be the right person to deliver that message because people want to receive messages from platforms that they're familiar with and from people they do trust that would help them. That will help them understand their challenges and also reach out for resources that will be really helpful for them. It's also important when we talk about education. Education is something that is very, very important. But I've learned over time in that we expect education to help behavioral change, which is so important. However, we need to know that education is one tool that we need to add with other tools because there are times that people have the right education, but they are surrounded with multiple competing priorities that perpetuate unhealthy lifestyles. And until we begin to provide those necessary resources for them that would help them to now elevate their health as a priority, our education messages may not really translate into behavioral change that we desire. So this is so important for us that as we continue to have the education messages, we incorporate into our programs vital elements that support behavioral change. And our intervention should include various wraparound services and various new modalities, innovative ways to reach the communities where they are so that we can move the Black community to closer towards health equity and strengthen the response within the Black community. So education is key, education is important, but it should be used as a part of a package with other tools so that they can support lifestyle changes and support healthy behaviors.
Yes, education is definitely a tool. And I think it's so impactful that you're talking about like trust and also the messenger. So that leads me into looking at empowerment. So we've talked about engagement and we've talked about education and recognize that there's more tools that are needed. But then let's hit the empowerment portion. And that's really just leaning into what that word looks like and how we need the strength and the rest and the care to really sustain our power source as a community to continue this work. And so, one question I had for you was, how does the EHE initiative plan to empower individuals in Black communities to take an active role in their own health and advocate for HIV prevention and care? And just to highlight that point again, that you mentioned that we may have all the resources, but it's the messenger. So, how do we empower folks within our community to not only be their own messenger, but to align with their health goals and their health outcomes and to advocate for themselves?
I think that is an excellent question because we need to empower the community uh, towards ending the HIV epidemic. But the beauty of this initiative, the ending of the HIV epidemic initiative, that it puts the community in the front and center of our proposed interventions. And it is very, very important for the Black community to ensure that we are present at the table. At the community advisory groups, it is very important that the Black community demonstrate added value and the significance of Black leadership and Black CBOs in leveraging that importance in ensuring that we can use that to ensure we have effective programs that reach the Black communities. This is of critical importance. It is also important that we strengthen Black CBO coalitions. Many of partners, many times that I travel across multiple jurisdictions, I hear different things from community, smaller community-based organizations. They tell me that they have credibility with their community, they have leverage with their community, but they are not in a position to receive federal funding because they don't have they don't have all that is without to receive federal funding and to show adequate accountability for the resources that have been provided. Although they have credibility with the community. So it is very important that we strengthen Black CBO coalitions where one entity may not have all that it takes to receive the funding, but you can leverage the collective strength and form coalitions so that you're in a position to receive these additional resources and now go to the community and serve the community effectively because the community knows you and the community knows that whatever they hear from you, they can trust it. You're a trusted messenger and it can help increase program outcomes for the Black community. I think another important piece is that the Black community has to work together and look at things from a strategic leadership perspective, looking at the short term, medium term, and long term priorities, and be positioned for capacity building so that Black led organizations can be poised for leadership in program implementation to end the HIV epidemic in their communities. It is also important that we strengthen multidisciplinary coalitions within the Black community. We see ending the HIV epidemic as an all society approach. So within the Black community, we can leverage academia, faith-based organization, the arts, creative art, health organizations, CBOs, law enforcement to have an all society approach that can be and have a body that can be representative of the community and bring that power and leverage it to serve the communities and ensure we move closer to health equity within the Black community. This is of extreme importance. And one of the things that I think that is also very important is for us to leverage public-private partnerships. The National HIV/AIDS Strategic Plan documents the importance of um, uh, public-private partnerships within our communities, and I believe that the Black community should be poised to leverage this. It is important that we optimize the resources that come from the federal government. But I have come to realize that the federal government can only be part player towards ending the HIV epidemic. We need to leverage even private partnership to partner with the government to end the HIV epidemic. The government can fund some things and the government may not be able to fund certain things, but we have multiple businesses, we have multiple corporate organizations that want to stand shoulder to shoulder to help end this epidemic. And within the Black community, we have so many, entities that we have supported. We have so many businesses that we've supported as a huge block. We have the arts that we supported, creative arts that we supported. And these are times that we have to strategically look at all these communities that we've supported and use them as a leverage to say, these are now opportunities for you to support courses that are important from the Black community, like ending the HIV epidemic. So this is very critical for us that we look at empowerment from an individual perspective. We look at empowerment from a corporate perspective, and we also look at empowerment from a public-private perspective to end the HIV epidemic in the Black community.
Wow, again, Captain John. This conversation is going so well, and I appreciate it. So, like, with that impactful statement, and really just in light of your substantial work experience, what actions do you believe communities can undertake to sustain their motivation in persisting with the effort to combat HIV, particularly in the South and then across all Black communities? How do we sustain it even though we are still like looking to strategize, create partnerships, find funding, sustain our workforce? What is, I would say, any actions or motivational um, feedback or comments you can make for us?
Thank you, Brady. I really appreciate that question. From what we know in the South is that the South represents about 38% of US population and accounts for about 52% of new infections. That tells us that there are certain unique attributes in the South that has perpetuated the disproportionate impact of HIV. And in some of my work and in reviewing on attributes of the South, I've been able to disaggregate some of this into systemic level challenges, provider level challenges, and community level challenges. And it is very important for us to know that despite all this, I haven't been to the 7 states that have substantial rural burden of HIV. I have met with tremendous leaders within the various health departments, very, very committed public servants out there wanting to make a significant change. I have met with community groups in the South that are just waiting to partner towards ending the HIV epidemic. But one thing that I think is very important for us is belief. What do I mean by belief? I have worked globally in HIV and I've seen us use US government resources in sub Saharan Africa and the Caribbean. And based on these resources and our combined technical expertise, we've been able to get some of these countries to epidemic control despite all the challenges and despite the fact that they have limited public health infrastructure compared to what we have in the United States. I know the situation may be apples and oranges in some cases, but our situation is not worse off than the situation in those countries. But them working collaboratively with us, we've been able to help them move the trajectory towards epidemic control in many of those countries. And as a result of that, I have a strong belief that if we can't do that in other countries, we have no excuse but to do it in ours. We've already started a bi-directional learning forum where best practices that we're learning from the global community is now being implemented within the US towards ending the HIV epidemic. So I think this is very important for us that we understand that despite all these challenges, we can overcome them if we have the resolve, if we take the problems one by one, if we form coalitions, if we work in communities, if we work with private partnerships, if we work together to mitigate those systemic challenges, those socioeconomic challenges, we look at the provider level challenges, we look at the health deserts, we look at the awareness within the Black communities, and begin to work closely with these communities towards ending the HIV epidemic, it will happen, and it will happen in the US. I am reminded of one of the quotes of Reverend Dr. Martin Luther King. And he says in one of his remarks, he says, "We are now faced with the fact that tomorrow is today. We are confronted with the fierce urgency of now. And in this unfolding conundrum of life and history, there is such a thing as being too late. This is no time for apathy or complacency. This is time for vigorous, positive action." And my charge to us is that this is time for vigorous, positive action. We are the United States of America. What we put our hearts to do intentionally, we always get it done. And we can do this together. And we surely will end this HIV epidemic. Thank you very much.
Captain John, thank you so much for taking your time out this afternoon to join me for this conversation and just leaning into those words by using engagement, by using education, by using empowerment, by using our collective force as a community, we will end this HIV epidemic. And I'm glad that you are alongside us in working towards that goal. So, thank you all to everyone for this conversation. It is critical and it is important that we continue to sustain our efforts and grow to new heights as we continue to work towards ending the HIV epidemic. And without the work of our Black elders, leaders, and current movers and shakers, none of these things would be possible. So, again, thank you, Captain John, for being here with us. And for everyone, make sure to follow the Southern AIDS Coalition on all of our social media platforms. Shout us out, share this live, and follow us. And also save the date. You want to talk about movers and shakers continuing to make work. And like Captain John says, going back into the community, the Southern AIDS Coalition has announced that it's our Saving Ourselves Symposium dates are August 15th through 18th. So make sure to save the date and to keep having these type of conversations. Thank you again, all, and you have a great day. Happy NBHAAD.
Thank you. Bye bye.
Thank you.